The topic is cardiovascular embryology. So what happened is when heart form, so the septum premium, it growth, it moves and break from the back, and septum premium move toward endocardial fusion. So they are atria and the ventricle. So what happened is septum primum, it moves toward the endocardial fusion. Okay. After that is the foramen that is formed from where the septum premium break is called foramen scandulum. Here we have foramen scandulum. So this part from where it moving toward the endocardial fusion is called foramen scandulum, and the point and the premium towards the endocardial fusion is called foramen primum. Okay, it's called foramen primum. One more septum produce called septum scandulum. Okay, fuse only one foramen left called foramen scandulum. Okay, to remove foramen scandulum, there will be a septum appear called septum scandulum. So here there will be a septum scandulum will be appear to remove foramen scandulum. Okay, in baby when the blood will move from here to here through so this place is called foramen ovale. So there is a space. When blood forcefully move from right to left atria between septum scandulum and septum premium, and the space formed between two septum is called foramen ovale. So this space is called foramen ovale, and sometimes foramen ovale closed. If it closed, so it's called fossa ovalis. What happens is after birth, the baby foramen ovale is closed. Ovale doesn't close, then paradoximal emboli. The blood will go to the right atria and then move toward the left atria and then to the left ventricle and from the left ventricle to the body. Okay, so the blood will go like this. Okay, so the emboli that is on the right side through foramen ovale move toward the left atria, left ventricle and to the body. Toxical emboli. So the patent foramen ovale paradoxical emboli form. If foramen ovale will not be closed, then paradoxical emboli will be formed. Is how ventricle septum form. How ventricle septum form is first muscular intravascular septum form and aorticopulmonary septum form. They get fused and membranous interventricular septum will be formed. So how it happened is like this. Muscular ventricular septum is formed, see, and here aorticopulmonary septum, okay, and they both get diffused and membranous interventricular septum. Okay, so after that is endocardial fusion separates atria from ventricle and make interventricular septum and atrial septum. Okay, after that there will be any problem in membranous interventricular septum, so then ventricular septum defect will occur. Okay, so then next topic is outflow tract formation and wall development. Migration issue. So the baby can have problem like transposition of great vessel, tetralogy of Fallot, persistent transcus arteriosus. So the failure of neural crest cells to migrate means there will be a failure of neural crest cells to migrate. Okay, so after we have valve development topic. So when endocardial fusion defect, then tricuspid valve will not form correctly, mitral valve or an aortic valve, aortic stenosis. Abstain anomaly. What is abstain anomaly? Abstain anomaly is if patient of bipolar disorder, she is pregnant and taking lithium, so baby will have abstain anomaly, means right ventricle will be small, right ventricle will be very small, and there will be a tricuspid valve will be till here and small ventricle, and atria will be big. Okay, so after we have heart embryology topic, and heart embryology here is from transcus arteriosus make ascending aorta and pulmonary trunk. Okay, bulbous cordis make smooth part of left and right ventricle, the smooth part of left and right ventricle. Primitive ventricle will make trabeculated part of left and right ventricle. Primitive atrium will make trabeculated part of left and right atria. Right horn of sinus venosus will make smooth part of right atrium. Left horn of sinus venosus will make coronary sinus. Endocardial occlusion will make atrial septum, membranous interventricular septum. So, common cardinal vein in right anterior cardinal vein will make superior vena cava. So, superior vena cava is made up of common cardinal vein and right anterior cardinal vein. Okay, inferior vena cava is made up of posterior subcardinal and supracardinal vein. Okay, so the mother blood, oxygenated blood through placenta will go to baby umbilical vein. So from umbilical vein, blood will go to the liver or to the inferior vena cava. It will not go to the liver because it's not fully developed. So it will go to inferior vena cava. So blood will go through ductus venosus to inferior vena cava and from inferior vena cava to right atrium. After that, what happens is in right atrium through foramen veil to left atrium to left ventricle and to ascending aorta and then supply to head and neck. And the blood coming from head and the blood that is coming from the head and neck to superior vena cava is deoxygenated blood, and this deoxygenated blood will come to the right atria, to ventricle, to pulmonary trunk, to lung, but not go to lung because of resistance. So the blood with the help of ductus arteriosus go to descending aorta and then supply to the full body.